I'm Liz Ulyash, and I am working in adult social care, and I'm currently the Chief Operating Officer, although soon to be Director of Mental Health Services, because we're going through a bit of a reorg at our leadership team. That I've been living and breathing Right Care, Right Person for the last few months, so I've been leading on these sessions, and that's my colleagues that have been supporting this bit of work. See, Julie is a consultant in public health, and Gemma is our AMP lead. Gemma, are you here yet? No. Okay. So if we go on to the next slide. Now we've got a set of slides we'll work through, but Right Care, Right Person is a model that was developed by Humberside Police, and it changes how emergency services respond to calls where there's a mental health issue. And it came from a place of they felt that they were picking up work that should have been dealt with by other organisations, services such as adult social care, health, or the voluntary sector, and that they were becoming an emergency service for mental health. And we've seen this replicated across the country. Certainly Surrey Police feel that way as well. So it's now being rolled out nationally as part of the work that's going on between police, health, and the government. So July last year, and I think it's the Home Office that's been leading on this, but the Department of Health and Social Care launched a partnership agreement for Right Care, Right Person, and that was signed by the government, the Police Chiefs Council, Association of Police and Crime Commissioners, and the College of Policing, and NHS England. And the model requires the police to work collaboratively with us. So we've got, and we'll talk more a bit about the structure in Surrey, but we've got a silver tactical meeting and a gold meeting, and that's got representatives from CCAM, Surrey Fire and Rescue, adult services, the acutes, and more recently the voluntary sector, and we're trying to get providers more involved. So that's where it's come from. Now my dog's decided to bark. And the aim of it is to make sure that vulnerable people get the best care and most appropriate service by reducing the reliance on police as first responders. So back to that, what I was saying at the beginning around, the police seeing themselves as an emergency service for people with mental health. And it applies specifically to concerns for the following. So concerns for the welfare of a person, i.e. what we call welfare checks, people walking out of a healthcare setting, people who are absent without leave for mental health services, and then 136 of the Mental Health Act, transport and voluntary patients. And if you go on to the next slide, you'll see that Surrey have chunked that up. So we go live for phase 1 on Monday with the first 3, which is welfare, AWOL, and walkouts. And then phase 2, they're looking to implement in July this year. We've done quite a bit of work on use of 136s with the police. The law isn't changing. And so although we've not kind of looked at that and the Right Care, Right Person formally yet, and just I'm assuming you all know what Section 136 is, but if you don't, it's a section of the Mental Health Act gives the police powers to take somebody to a place of safety, to detain somebody on a Section 136 up to 24 hours where they think they're a danger to themselves or others because of a mental health need. So, and that's used quite a bit in Surrey, as it is in other forces. The important takeaway from this is up until March, this was going to be an all-age policy. However, just before we're going to go live in March, and we all breathe a sigh of relief because we got this extension, the police called us to an extraordinary meeting to let us know that there is currently work going nationally on guidance for how Right Care, Right Person affects people under the age of 18. So when I say children and young people, I mean legally children, not sort of 10-year-olds, but anybody under the age of 18. So while that guidance is being developed with the DfE and directors, the Association of Children's Directors, children are out of scope. So if there is a child, and we'll talk a bit more about this, anybody under the age of 18 who is impacted either directly or indirectly by one of those first 3 things, the police are saying they will deploy. And I think that's really important. And one of the reasons we asked for the extension when the police, they told us on the Thursday, the go live was the Monday, and they felt it was just a comms issue, that we needed to make sure that everybody knew children weren't in scope. And we were very clear at that meeting, no, this is a change in practice for us. We have to think about, is there a child in that household now? So they then gave us sort of 5 weeks grace to make sure that we were happy with our processes and procedures and the bit about children's. So that's the timescales. Are there any questions on that? And we can have a discussion at the end, but not, we'll move on to the next slide. So what I've been telling people is a bit about the background, a bit about when it does apply, because it's not just that the police will never ever go out again. The police have core duties and they don't change as a result of right care, right person. So where Article 2 is triggered, and Article 2 of the European Convention on Human Rights, which is the right to life, if that's triggered, the police should deploy. They would have a duty under this article. So if you think there's a threat to life, that's what we need to be telling them. Same as Article 3, which is around torture, inhuman treatment or degrading treatment or punishment. If we think there's an Article 3 issue going on, we refer it to the police because they have a duty to respond to that. The core policing duties are protection of life and property, preserving order, preventing the commission of offences and bringing offenders to justice. None of that changes as a result of right care, right person. So where any of those things apply, the police should deploy. Because what they're saying with right care, right person is what Humberside Police said they want to do is go back to core policing work, and all of these are core policing work, which may impact our work because we work with people that there might be a threat to their life, or they might be experiencing torture, or any one of these things. So these things still apply, and if they're triggered, then we have to refer to the police. The other bits are. Do you want to go to the next slide, Sarah? Where the police have assumed or responsibility already, or they've created risk, so what they class as common law. So the police may owe a duty of care to protect a person from harm where they've already assumed responsibility. So, for example, where they've taken somebody into custody, they've already assumed responsibility, so, because they're under their care, or where they've created a risk of harm to that individual by their actions. And it's really important to remember the police will continue to respond to investigate a crime that's happened or is happening, to protect people, because that's core policing duty, where we think there's a real and immediate risk to life, and or serious harm, not just risk to life, but serious harm to somebody. And as I've said, this work is going ahead. I keep stressing the bit about children and young people under 18, because we will have to think, if we're wanting a welfare check and we think there's a child in that household, and that child could be 17, we need to be checking that. We need to be saying, finding out, because the police have said they will deploy. And if you think back to that really tragic case over Christmas, that kind of sobers you kind of into thinking, that is there a child? Is there a risk to life? Is there is there a child? They'll deploy. And the next slide, Sarah, and I can't stress this enough, is if there is an obvious, real and immediate threat to life, what they describe within a collapsing time frame, the police will not go through the right care, right person toolkit, which I'll talk about how the core handlers work in a moment, but they won't do that. They will deploy immediately, which is the current practice. If we think somebody's being murdered next door, we wouldn't go, make a right care, right person call. We would be phoning 999. So it's just to remember, and I keep stressing this, core policing work doesn't change because of this. Okay, so going on to the next slide. So the process is that the call taker in the police control room will assess the circumstances using the right care, right person toolkit. And we've tried to put some information into the guidance, which includes the script that they'll be using, so that people know what they'll be being asked. And they will also use something that they already use called Thrive, which is around threat, harm, risk investigation, vulnerability engagement. There isn't a test, so you don't need to remember that, and their national decision-making tool. And that's what they currently do to triage calls, but they'll overlay that with this Right Care, Right Person toolkit. And what the call handler needs to do is to make sure they've taken as much information as they can, and that they gather as much information as they can. So from, checking their PNC, the Patrick Police National Committee, or their niche system, to make sure that they're as best equipped to triage that call as they can be. And so if we're phoning to make this referral, we need to expect to be asked probing questions, and they will ask probing questions. And as I say, at the back of the guidance, we've put in the call handler's script, so you know what you're going to be asked. But it is around who, what, where, when, how, why. And we're really stressing that we're not to use police are stressing we're not to use any electronic referral system. It has to be a phone call. And the reason for that is because they want to have this conversation. Also because things have been missed when we've done things electronically. So they're saying it really does have to be a conversation, so that we can say, because if we honestly believe that the police are the right people to go and do that welfare check, then we need to be able to articulate that. We need to be able to say, well, this is what we've done, this is what we think, and this is why, and have that conversation. There's also an escalation process, which we'll go through as well in a moment. So that's the other reason, because if you're not happy with their response, then we will be asking for an immediate escalation. I'll talk a bit more about that in a moment. Are there any questions so far? Are we all okay with this? Okay, next slide then, Sarah. I don't think Gemma's here. I can't see her, so I'm going to carry on, but normally Gemma does these slides, so you're stuck with me now. Sorry, it's dull hearing my voice, but. So the role of the police call handlers. So you phone up and they will, as I've said, they will use the toolkit alongside other operating models, their Thrive, the national decision tool, and they will triage the call that comes into the centre, and they will decide on the appropriate course of action, i.e. whether they think, actually, yes, this does meet our threshold, yes, we'll send out the police, or no, we think it needs to go somewhere else. And what the police have done is they've rolled out training since about January for all their call handler staff about Right Care, Right Person. And they've developed flowcharts and scripts, which they've shared with us and has formed the basis for a lot of our guidance. So there are clear expectations of the call handlers. So they will be expected to effectively triage that call, use the Right Care, Right Person tool. They make the decision about the threshold for police intervention. And if it's not police intervention, they will be signposting or possibly referring, and this is what we're slightly concerned about, we'll see an increase in scarves. If there's a non-deployment, they've got a script as to why, and they will log all their calls on their CAD system, and they will give the caller an ICAD reference number. And what we're saying to ourselves is it's really important you take a record of that number, and that you put that onto LAS. So if you make a Right Care, Right Person call, it's declined, they've said, no, we don't think it reaches our threshold, we need to keep a record of that number, because A, we're monitoring the impact, and B, if in half an hour's time, actually some more information has come through, we can go back to the police with that ICAD number and say, actually, we've got additional information, we do really think it's you now. And the really important thing that we need to stress as well is that the call handlers make the decision. So if they say, yes, this is a police deployment, the officer that deployed can't go out and say, nah, this is not Right Care, Right Person, we're not going, or this is whatever. They can't do that. It is the call handler's decision. And on Monday, when they go live, they've got various subject matter experts going in to their call handling centre, which I think is at Mount Brown. So Gemma, our AMP lead, is spending the afternoon and evening there so that they can give advice and information as needed. And other organisations, I think, have visited the call centre or have gone in. The other thing the police did was hold a training session. Based on the training session they gave their call handlers to the partners. It was only an hour. Their call handling training is much longer, but it was an hour briefing session based on that. And again, I've used some of that information to go into the guidance. So next slide. And this is a little bit more detail on what all these different things are. So welfare is the one that we think will impact us the most. So this is where we are worried about somebody and we've asked the police to go and check on them. And I know it's not that easy to get the police to go out and check now, because I hear it all the times from social workers. They've asked for a welfare check and the police aren't keen. But there is a flow chart, and the call handler will need to follow that flow chart to see if the police should respond. And again, that decision will be based on the legal duty. The bit we said at the beginning, Article 2 or 3, are an assumption of responsibility or core policing duty. And we've got a case study on this in a moment that we'll have a look at. But what we need to do is consider very carefully whether we need to phone the police. And there'll be things that we need to do before we phone the police, but we're not saying don't ever phone the police where you think there's a welfare check, but there will be steps you'll need to go through to ascertain the whereabouts of Mrs. Miggins or whatever beforehand. So what we're saying is, before you make the call to the police, we need to be absolutely convinced that the police response is the only option for keeping that person safe. We need to think about other actions, because we have to remember the Care Act applies. We're not just suddenly saying every single person, we have a duty under the Care Act around people with care and support needs. So we need to consider that. We must be able to explain to the police why we think they're the suitable agency, and we must think there's an immediate risk to that person or serious harm. And what we're saying to people, you need to check if there's potentially children present, because if there are children present, then the police should deploy. But if not, we need to be doing everything we can within our power to check on Mrs. Miggins first. So and this is the case study, so I don't want to preempt it, but what have we done before we phone the police? We can't just say, well, we haven't heard from Mrs. Miggins for a week, we better phone the police. We've got other things that we need to do. If we just go on to the next slide, and it's a bit more detail. So absent without leave, and if Gemma were here, she'd be saying that this is a term that's used frequently in mental health, and it's a technical term they use when a person's been detained under the Mental Health Act. So they might be on a Section 2 or a 3, and they've left the mental health facility without proper authorisation or permission. Now, when people are on detention, they are given leave. They are allowed to leave the hospital, but that's done with agreement with the responsible clinician, and it's, you have to be back at a certain time. So AWOL could be that either they've walked out the ward without permission, or they've gone on leave and they've failed to return back to the place where they've been detained to. It's usually Farnham Road for us. So, but what the police are saying is the duty of care owed remains with the place where they were detained. So if somebody walks out of Farnham Road, it's up to the staff at Farnham Road to find that person. It's only when they've done everything they can and they still can't find that person, they've done all the reasonable steps to locate them, they then can phone the police. But the police won't just, if Farnham Road phone up and say Mrs. Miggins has gone AWOL, they won't just go and look for her now without at least some attempt by the hospital to find them. And that's very clearly where somebody is detained. The other bit is walk out of healthcare facilities. So that could be any healthcare setting, and what they've covered there is general hospitals, EDs, GP surgeries, community services. And that, for example, is Mrs. Miggins has been sitting in A&E for 6 hours. She's had enough. She's got a cannula in her arm. She's walked out. Again, the responsibility to try and locate Mrs. Miggins will be where they walked out of. So if somebody is sitting in ED, or there's somebody in an acute hospital and they've left, it's up to the acute hospital to do everything they can to locate that person. And it could be phoning next of kin, or that person might have gone home, they might find her at home. They might be in the car park, but it's not for adult social care to go looking for them, or the police initially. It'll be, and if that person decided that is a MISPA, then they should be phoning the police. But the duty of care will remain. And obviously you can imagine this is going to impact our acutes significantly. The other area that was raised by our legal team is around doles. And I did speak to the superintendent that's leading on this, because he's had one-to-ones with lots of us. So you've got somebody on a doles and they've walked out of a hospital, out of a care home, and would you phone the police? And what he said was, well, there will still be a duty with the place where they walked out of to try and find them. Even though we know they don't have capacity to make the decision to leave, it's still not a police matter yet. So the care home should be looking for them. They should be notifying us that Mrs. McGinn has gone missing, but it should be up to the care home to find her in the first instance. And when they haven't, then they can be phoned to the police. Okay, so I think the next bit's our case study, and then I'm going to pause for any questions before we go on to the last few slides. So our case study is Mrs. Miggins, who's my fave, and she's 85 and she lives alone. She has care workers coming in 3 times a week. Her family live up north and they haven't been able to get hold of her on the phone. So they call us for help. And we speak to the care agency. They said, well, we only went in yet, you know, we're not due to go in for another 2 days. We would call the police for a welfare check. Possibly prior to Right Care, Right Person, the police would go and check on Mrs. Miggins and may enter the property. Actually, from Monday, they'll expect us to have taken all reasonable steps to find Mrs. Miggins and check on her welfare and whereabouts. So have we spoken to the care agency again? Have we called the GP? Have we done a home visit? There's a bit of a debate about the key safe, but is there a key safe? Have we got permission to use that? Have we knocked on the door, looked through the letterbox? Have we discreetly spoken to the neighbours? Our teams are clearly concerned about doing some of this stuff, and we have just developed some guidance called no response guidance that we can share with you as well. And it gives advice as to what to do if we're not getting a response for somebody. And we've checked that out with legal as well, because people are concerned about us peering through people's letterboxes. I'd rather peer through a letterbox than know that Mrs. Miggins actually experiencing some harm on the other side. But we have got that guidance, and I've noticed an email from Paul Morgan, so I think we're nearly at the point of finishing that. But when we've done all of that, we can then call the police for a welfare check. So as I say, they will expect us to have done things first before we phone them. But if we're really concerned, and we've had a whole debate with the fire service and the police about who has the right of entry, because I think people are assuming that fire service can break into people's homes. They can't. They can if the house is on fire or if they think there's a risk of fire, but they can't just go smashing in somebody's front door. So it's doing the right care, right person stuff has brought out quite a lot of how people interpret what other people's duties are. And that was one of our concerns when we first looked at this, was being really clear as to whose duty is what. And I think Gemma's here, so I don't know if you want to say hello, Gemma, and tell me if I've missed anything.
Hi, I'm Gemma. I'm the manager of the AMP service. Apologies for my lateness. I was caught in another meeting. Yeah, I don't think there was anything else to say. Yeah, apart from it's just thinking about answering all the or sort of having answers to all of the questions before making those contacts. And like Liz said, people are quite concerned about the expectations on them as services. But I think a lot of us would be doing all of this anyway. We wouldn't just have the police as a first port of call. But it's just having all of those answers. And I'm sure Liz has already mentioned a couple of times about just ensuring about whether there's children present, because that is a really important part of the information, because that will mean an automatic deployment. So if we are giving that information, give that sort of as early as possible in the telephone call. But I think it is the impact is not really able to be predicted of what the impact will be for us, and especially with you guys getting the increased of scarf reports or increased referrals, we're not quite sure how that will pan out at the moment.
And part of that is because that data isn't held by the police, so they don't know how many welfare calls we make, Surrey and Borders make a week. So a lot of this has been done from, as much data as we can, and we'll talk about the incident review groups in a minute, but there is no hard data that says we get 20 calls a week from adult social care or contact centre or whoever to say we need a welfare check. So we don't know what the impact will be going forward. So if we go on to the next slide, I think that's the escalation. And this was the bit I was saying at the beginning. There is an escalation process, and we have to do it in, there's an expression, I think it's warm time, but it has to be done immediately. So the call taker takes the call. You don't agree with what they're saying about the welfare check, so we can ask for that to be escalated. And they've given their people that they would escalate to. So in their first instance, they would escalate to their subject matter expert. And we think our equivalent is an ATM or a duty manager. If we can't resolve it at that, then we would expect that to be escalated to their force incident manager, which is, we've said our equivalent would be a team manager. This is in hours. And then again, if we can't resolve it at that level, it goes to senior manager and their critical incident manager, and ultimately they will go to gold. And for us, that will be our area directors. And out of hours, we've done it quite differently. We've given it's the senior manager on call for the kind of, initially it's EDT, and then it will be the senior manager on call. We'll be trying to resolve this at that level. And we're hoping we don't get to the point where we get to gold having to get involved, but if we really feel strongly and we really think that they should be visiting, we should be escalating that. We don't have to just say no, I don't, that's fine then, if we honestly believe that they've not made the right decision, and we can do that. Yeah, and then finally, I think it's the last slide, is just to let you know what work we've been doing. So the police have got a structure in place. They've got their gold meetings, that's chaired by the Chief Constable, Tim DeMeyer, and people like Helen Coombs will go to that, and Chief Exec from the Acutes, SABP, and there's a meeting next week actually, but they don't meet as frequently as the other groups. Then you've got the Silver Tactical that I go to, Gemma goes to, and Julia attends, and that's a lot of the work is kind of policy work and things is done there, and that's been meeting weekly. They've had a break because of Easter holidays, but we met yesterday as the final meeting before go live, and we've been kind of using that as well as an assurance, everybody saying yes, we're ready to go, we've moved to a green or not. And then you have the weekly bronze instant review group, and that's where case studies are looked at, case scenarios, and anyone can take a case scenario. Gemma goes to that. And I think they said yesterday they've reviewed in excess of 75 cases, yes, 72 scenarios, and particularly re-reviewed the ones where they came out as red and ambers. And that's where we're really getting our assurance from that group to say we can challenge. I mean, Gemma, you go to that. I don't know if you want to talk about that at all.
Yeah, so we have they're normally real life cases, so this happened yesterday, so let's bring it and talk about it. And it's we have police, CCAM, so South East Coast Ambulance, people from the Mental Health Trust, social care, and the fire service, and we just try and unpick, this is what happened, this is what we could do differently, this is what will have to be done differently come RCRP going live, and then we sort of rag rate whether we think that there needs to be more organisational input to make things, like, is there going to be a gap come Monday when it goes live, and they're rag rated, and then we've brought out themes. So I think one of the biggest themes was communication, so making sure that all organisations are both talking to each other and working out, rather than just assuming that somebody else is doing something. And we're going to be continuing those after Monday as well, so they will continue on a weekly basis, so we can be bringing cases that may need to be being a bit more unpicked, sort of how is RCRP going, has this had an impact? Yeah. So is everyone continually to be prepared, and is it going well or not? So those are going to be continuing on a weekly basis for at least a couple of months, just to see how everything's going. So if there are particular issues or cases that come up after Monday, then please do email them through to Liz and I, and again I can take those to the review meetings as well. So we're actually really looking at live issues, to make sure that we're learning from them and getting processes in place to make sure that those things don't keep happening.
And the silver groups are continuing as well, because obviously we need to monitor the impact of this going forward. Staff guidance has reached its final stages. That was signed off at the Practice Assurance Board and then senior leadership team yesterday. So that will be going out to all staff. And that includes an escalation process. And I've given, in the escalation framework, which I can share with you actually, Claire, I've given, although it's got the contact centre in case they want to escalate to us, we're not escalating, they are. But within that, I've given job titles so that they know if they need to escalate, because there's a case in Guildford they want to escalate, that they need to ask for the team manager or they need to ask for the senior manager. But I haven't given names because otherwise that document's going to be huge. But that's in place now. Been working with David Modi on a risk assessment. That's now, well, we did the work before and David Modi's helped me complete that. And that's on our risk register now. And it's also, the risk assessment is going up to CLT. Helen's taken that in a couple of weeks, I think. And I think David's taking it up to Cabinet or ICAB. We've done an equality impact assessment, but we're just reviewing that in view of neurodiversity and learning disabilities. So Barbara Anna is having a look at that for us. I'll come back to comms. There's a task and finish group that Claire's been part of. We haven't met massively frequently recently, but we're going to meet on Monday because that's the go live date. And we're just going to look at where we've got to with everything and what else needs to be done, because we do need to review other policies and procedures in view of right care, right person, the obvious one being the no response guidance. And the important thing to remember is this is not our policy change. This is a police policy change. This is our response to it. We didn't say to them, we think a really good idea is right care, right person. It's a police policy. We have to respond to that. We have to be able to respond to that collectively. And then there's a comms plan, and Laura Downton's been working very closely with Vicky Miles, the police comms person, and you've probably seen an email out from Lee today. And there's various police, because it's a police policy, they are leading on the comms plan, and they are going to be sending out all the external comms, all the internal comms they've done, external comms, so that would be Surrey and Borders, the council, other partners, and there's a press release going out, I believe, Monday. And there's also, they've got specific, sorry, could somebody switch their mic off because I'm getting some background noise? Thank you. There's specific branding around this, and obviously there's got to be information going out to the public, and I've put the police in touch with Surrey Care Association so they can think about how they get the messaging out to our providers, because they're a key partner as well. I don't think I've missed anything else. It has, and we've had, as I say, 4 of these sessions. This is the 5th. We've reached over 800 staff, and Sarah's put in a couple of mop-up sessions, and I've been to CLT, and I know that cabinet members are very interested in this, and so we've briefed upwards as well. As around us. So that's kind of it for the presentation.